Hi everybody, this is Dr. Jamie Scully and I wanted to get on here today and talk with you about urinary tract infections or UTIs and what they are, what symptoms are, and what you can do to prevent them using natural therapies. And so what is UTI? So UTI stands for urinary tract infection, and it's a bacterial infection in the bladder, and about 50% of women will experience at least one UTI in their life, and unfortunately many experience more than one. And so women tend to get UTIs more than men, and that's just due to differences in our anatomy. And so as women, our urethras are much shorter, and so it's easier for bacteria to get up into the bladder and cause an infection. The infection is usually bacterial, and it's usually caused by bacteria from the stool. So usually E. coli or staph from the stool. And so that is why many women were always advised to wipe front to back instead of the opposite, because that just reduces the amount of bacteria that can get to the urethra and then up into the bladder and cause those infections. So symptoms of a UTI generally are pain during urination, urgency, which is you just feel the urge to go to the bathroom, even if you already have recently or you just finished urinating, and frequency. So frequency just means that you are feeling the need to use the bathroom every 1 or 2 hours, and you're just not able to hold your urine for any longer than that, even if you just urinated, or you know that your bladder isn't full. Also, there can be some abdominal pain. Sometimes there's pain on the side or in the back, just discomfort there, or pressure in the abdomen, just because the bladder is so irritated, and the urethra is so irritated as well, and so that's what causes that pain when you urinate. You also might notice that your urine looks cloudy, and the color might change a little bit too. So it may become a little bit darker or more orange or brown, and that might be a sign that there's blood in the urine, because like I said, the bladder is just very irritated, and so you can get some blood in the urine as well. So how do you test for a UTI? So it's usually a pretty simple test that your doctor can do in the office, and it's called a urine dipstick, and this is going to look for different markers of infection. But I do want to say that if you do this test, it is important to get a good sample. And so one way that you do that is to do a clean catch and do a midstream catch. And so what you'll do is you'll have your cup that you're going to collect the urine in, and some antibacterial wipes. And so what you want to do is you want to take the wipes and then wipe front to back down the center, find a clean spot on there and do on one side, on the other side, and then find another clean spot and do the opposite side. And so this is just going to prevent any bacteria or skin cells that are on your skin from getting into the sample, and just so you can get a really good sample and a good reliable result. And so you want to get also a midstream catch. And so what that means is you're going to urinate a little bit, hold it, and then collect it in the cup, and then hold it again, and then finish urinating. And so this just flushes out the urethra, and again just gets that bacteria or any cells that might contaminate the sample, and kind of might throw off some of those results in there. So that's a good way to collect the urine for the sample, for the dipstick. So what you're looking for in the urine dipstick test are a couple different markers. And so leukocyte esterase is one of them, and nitrites are one of them. And so if these are present, there's a really good chance that there is a urinary tract infection going on. So leukocyte esterase, this is an enzyme that's found in white blood cells. And so if there are a lot of white blood cells there because there's an infection, then they're going to release this enzyme, and that kind of tells you that there's an infection, there's a lot of white blood cells, the immune system has sent them there to fight something. And the nitrites it's a product that bacteria, if they're there, they can convert nitrate, which is usually in the urine, to nitrite. And so that's just another marker kind of telling you that there's bacteria present, there's probably an infection going on. So other things that you might, your doctor might also look for are blood or red blood cells. So you might be, sometimes you can see a color change in the urine, and it's very obvious that, it's not yellow, it might look a little bit orange or brownish, but sometimes if there's not a lot of blood, you can't see a definite color change. And so a dipstick will also tell you if there's red blood cells, or just like minute amounts of blood in the urine. So that can be really helpful as well. I'm just looking at my notes here, don't want to miss anything. So if there are some of these things found, your urine might be sent for culture and sensitivity. And so what that does, they look at it through a microscope. So they're going to look at a lot of the same markers on a urine dipstick, but they're going to look at it much more closely through a microscope and then test it and see are bacteria there, which bacteria, and then which antibiotics would be most useful against that bacteria. So that can really help, especially if you go on antibiotics and say it's not working. You need that information to choose an antibiotic that would be really effective. Antibiotics are usually, at least in the conventional world, are usually the treatment for UTIs, and they usually clear them up. But I wanted to talk about preventing UTIs. So there's a lot that you can do with natural medicine to prevent them. So hydration is very simple, but it can be very effective. Being adequately hydrated, with water, electrolyte drinks, trying to avoid caffeinated drinks, anything that's going to dehydrate you, because you want to be able to kind of flush out the kidneys, the bladder, the urethra, and just get bacteria that might be there just flushed out of your body. And so one way that you can know if you're well hydrated is to just look at the color of your urine. You want it to be light yellow, and not, if it's very, very yellow, if it's really dark yellow, then you're not quite hydrated enough. So make sure that you drink a little bit more water until you see it go to kind of a pale or light yellow. So proper hygiene, kind of something I mentioned before earlier in this video, especially for women, wiping front to back and not the opposite, because most of the bacteria that cause UTIs comes from the stool. So if you're wiping back to front, then you're just more likely to get that bacteria near the urethra, and it has a better chance of getting up into the bladder and causing that infection. Also, kind of going along with that, avoiding any feminine deodorants or washes or douches or anything like that. If you are bathing every day and you're cleaning yourself, you're going to be clean enough, and you don't need to use any of these products. These products can also change the pH of the good bacteria and bad bacteria in your urinary tract and in your genital region. And that can make you more susceptible for infections too. So you don't need to use these products. I really think they do more harm than good, and they may actually make you more susceptible to infections. Also, part of hygiene is urinating after sex. And so some women can get UTIs, or just more likely to get them after sex. So it's just a good idea to make sure that you go to the bathroom and just flush out your urinary system after sex, and that can just get bacteria out of there, and you're less likely to develop an infection. Cranberry and d-mannose. So many people have heard of using cranberry and cranberry juice, cranberry capsules to treat urinary tract infections, and they can be used to treat infections. I usually use a combination of other herbs as well, but cranberry can be really great to prevent them because it contains d-mannose, and so d-mannose is something that prevents bacteria from attaching to the bladder walls. And so if the bacteria can't attach to the walls, then it's less likely that it can stay in the bladder and cause the infection. And so usually what I will recommend is drinking cranberry cranberry juice, so unsweetened 100% cranberry juice is really the best, and so you want to avoid any added sugars or any sweeteners in there, and so just drinking that a couple times a day. You can also add it to blueberry juice, and so blueberry has some of those same benefits of the prevention of the UTIs that the cranberry does, and it can make it taste a little bit better, because I know cranberry juice can be very tart, and so drinking that a couple times a day just on a regular basis can help to prevent some urinary tract infections from developing. Or if you don't like the juice, also you can find these in capsules as well, and so that can be a really easy way to take these things if you don't really like the taste of juice. And so probiotics. So probiotics are really important, especially if you have taken antibiotics for a UTI in the past, because the antibiotics, they can definitely wipe out that infection, but they also affect the good and bad bacteria ratios in your urinary tract and your reproductive tract. So this is something that you can take, after you're done with your course of antibiotics, or just on a regular basis to prevent UTI. And so there are two different strains that have been studied in preventing and treating, or sorry, just preventing UTIs. And so these two strains are called Lactobacillus reuteri and Lactobacillus rhamnosus. Yeah, so these two Lactobacillus strains are they're specific for urinary tract and the reproductive tract too. So these ones, if you're looking at probiotics, sometimes they'll have a formula that they might label as like specific for women, and so usually if it says that, it's because it has these two strains in it. So that's what you want to look for if you're at the store looking for a probiotic like that. So before I wrap up, I just want to address when you want to go to see a doctor. So, some women can just kind of take care of this at home, and it may just last a few days, and then they're fine and they're over it. But sometimes if UTIs are not treated, they can become much more serious. They can develop into a kidney infection, and so that's definitely a time that you want to go and see your doctor. And so symptoms of a kidney infection, it's many of the same symptoms of a UTI, like painful urination, frequency, urgency to go to the bathroom, but you may also develop a fever, nausea, vomiting, really more severe like side or back pain. And so if you have any of those develop, that's definitely a time that you want to call your doctor or get into a clinic and get tested and see what's going on. Because if the bacteria have gone from your bladder up into your kidneys, then it's a much more serious issue, and if it's not treated, it can lead to some pretty bad kidney damage. And so in that case, usually antibiotics are more strongly recommended in that case. So I just want to let you know, that's definitely a time to see your doctor about what's going on. So I hope this helped you. If you have any questions for me, please let me know and I'd be happy to answer them. And thanks for watching. Have a good day. Bye-bye, guys.